Okay. Greetings, people of tomorrow. Hello, everyone. Allow me to introduce myself. I'm Sydney Chandra, currently serving as the Director of Global Health for AMSA International, tenure 2023-2024. Welcome to this series of the AMSA International Podcast under the title Global Health, Future Directions and Career Paths. In this episode, our speaker today is Professor Tikki Pangestu, a visiting professor at Yong School of Medicine, National University of Singapore. Among many other accolades, previously he was the Director of Research Policy and Cooperation for the World Health Organization in Geneva, and was also a visiting professor at Lee Kuan Yew School of Public Policy at NUS. Prof. Tikki, it's truly an honor and a pleasure to have you with us today.
It's a pleasure.
Great. Great. For our audience here at home, please tell us about you, your works, and your career path or expertise.
Yes, I guess it all began when I was still in high school. Okay, and like many of us, we were influenced by certain teachers. And in my case, when I guess in the last 2 years of high school, I had a science teacher who opened my eyes to the wonders of molecular biology. Remember
Wow.
this is in the mid and the late 60s, before all of you were born. Okay. And it was only about
Yeah.
10 years after the discovery of DNA. So
Wow.
I was really fascinated by DNA because DNA is like the blueprint for life. And
Mhm.
if it's the blueprint for life, it also means that our health as we grow older is also controlled by our DNA. So because of that particular teacher, I became very interested in science and in research, not so much in medicine, but in the idea that molecular biology will unlock a lot of the secrets of life as well as understanding of disease. So as a result, when I went to university, I studied biochemistry, microbiology, and infectious diseases, immunology, if you like. And completing those studies, I then really wanted to do research, okay, rather than go into clinical sciences. So what I did was I ended up teaching at the Faculty of Medicine at the University of Malaya in Kuala Lumpur for about 22 years. And that is basically teaching undergraduate medical students, mostly in the subjects of microbiology and immunology. But at the same time, as well as teaching and doing hospital service work, I ran the diagnostic laboratory in the University Hospital in Kuala Lumpur. But more importantly, I did a lot of research, and my particular area of research was dengue, as well as typhoid fever, as well as other areas like autoimmune diseases. To cut a long story short, after about maybe 22 years, some of my research came to the notice of people at the WHO in Geneva and Switzerland. So in the mid 90s, they started inviting me to meetings in Geneva, mostly around infectious diseases. And when I started going to WHO, that's when I first realized about the importance of global health. Okay, when you're working in a university in a country, you're concerned mainly with, as I said, teaching the students, which was very important for me, doing research with relevance to the country you are actually working in. But when you join the WHO, you realize that health is not just limited to one country, it's for the whole world. Okay. So I joined the WHO in 1999 and I stayed there for 13 years. And that's the time that I my eyes were really open to the importance of global health. Okay. And then in 2012, I retired from the WHO. At that point, the NUS asked me, are you willing to come back into a more academic role? in terms of teaching students, initially at the School of Public Policy, and now back to the School of Medicine. And basically, what I have done since retiring from WHO is trying to, let's say, open the eyes of students to make them more aware of the importance of global health. So that's a brief summary of my career path in terms of what has happened in the past and where I am today.
Wow, wow. It's really stunning how you began from something very academic and eventually went to the broader sense of policy and global health. I'm sure I'm not the only one inspired to be as impactful as you, Prof. Tikki. Some
Yeah,
of our
but
audience.
perhaps Sydney, more importantly, after
Mhm.
all that, I came back to teaching. Okay,
Yeah.
if you ask me what my passion is right now, is really influencing your generation, to become more interested in global health. So in a way, I've come full circle.
Uh-huh. Yeah, definitely. Really interesting. Yeah, we can really see that passion through as some of our audience here might have previously heard your presentation and the East Asian Medical Students Conference, AMSA International's flagship program in Singapore last January. There you discussed new definitions of global health involving the rise of globality and supraterritorial processes as well. Share your views about this. What is global health?
Yes, I think global health at the moment is really suffering from quite a big problem in the sense that the narrative around global health is very much dominated by the rich countries of the West. Okay, in terms of what the priorities are in global health, in terms of the resources, the money that's available for global health work, that comes from the rich countries. So they basically decide what the developing countries should be doing. They decide how much money to give. They even tell the developing countries how to spend the money, okay? And at the same time, also importantly, not giving the developing countries a say or a voice in what happens in the global health arena, okay? So basically, there is a big inequality in the whole manner, in the whole structure, in the whole implementation of global health activities. And that has to change, okay? It needs to be more inclusive. The developing countries, you're talking about the lower middle income, even the middle income countries, they need to have more of a say in terms of what is happening in global health. So that's basically uh, the situation right now in terms what is global health, because that was your question. Global health at the moment is dominated by the rich countries, and that has to change. It has to be more equitable. It has to be more inclusive of the voices of the developing countries.
Wow. Okay. Interesting. Perhaps a little follow-up question on this, Prof. Tikki. You mentioned about priorities being that of the richer developed countries. Do you mean that NCDs and non-communicable diseases being more of a priority instead of the tropical diseases and communicable diseases in developing countries, or perhaps is there another context in that?
I wouldn't put it so bluntly to say that non-communicable diseases, because of its higher prevalence in the rich
Mhm.
countries, have been, let's say, imposed upon the developing countries as being of a higher priority than tropical infectious diseases. That might have been true, maybe 20 years ago,
Mhm.
25 years ago. But after COVID, it's very clear that communicable diseases, if anything, is going to hit the rich countries harder, okay, than the developing countries. So I think in that context, the narrative has changed a little bit in the sense that I think overall there is, even at the moment, actually, I would even say the priority is actually more on communicable diseases simply because we're just 3, 4 years after COVID. But at the same time, I think non-communicable diseases has not dropped off the radar screen, although I would say during COVID, that was probably neglected a little bit. But as you know, countries like Indonesia, yes, we still have tropical diseases, but we also have big problems with diabetes, with heart disease. And as you know, the number one cause of death in Indonesia is actually stroke. Okay. So I would say at the moment, I think there is probably even more interest and priority towards communicable diseases because of COVID. But at the same time, I don't think NCDs are going to be neglected, especially in countries like Indonesia. The particular problem with Indonesia that's related to NCDs is actually smoking. Okay, I think well, you girls are fine. The girls, the ladies in Indonesia have a prevalence of smoking of only about 7, 8%. But the boys, come on, 66% of adult Indonesian males smoke cigarettes. I mean, think about that statistic. It's frightening. It's probably the highest in the world. And as you know, if you smoke, you're going to get lung cancer, you're going to get diabetes, you're going to get heart disease, etc., etc. And imagine the cost of that to the healthcare system. Okay, so yeah, I mean, the quick answer to your question, yes. At the moment, I think there's good awareness for communicable diseases, not just COVID, obviously. Other things have come up, like at the moment, there's a big concern about dengue, okay, not just in Indonesia, but in many other countries. Um, but as I said, I think NCDs in the longer term are actually going to be important as well.
Interesting indeed. I think that your background, particularly, is also a really prime example of bridging health research and policy. How can we bridge those two, health research and policy, and why is it important for people in medicine to do so?
Okay, my first comment on this is that researchers and policymakers basically speak different languages. Okay, researchers and scientists, whether it's a clinical researcher or a biomedical researcher or a public health researcher, they tend to talk in very scientific, technical terms. A lot of policymakers, in turn, are usually politicians, okay, who may or may not have a background in health, medicine, science, or even engineering or mathematics. So the language, there is a disconnect in the language, okay? So in order to bridge what I call the know-do gap, the gap between knowing, that is the research, and doing, that is the policy. So the way to bridge that know-do gap is to have let's say, dedicated structures within, for example, the Ministry of Health to actually bring those two communities together. Okay. And that's part of the work that I did at the WHO. I established in about 25 countries what were called evidence to policy units within the Ministry of Health. So think about these people as knowledge brokers. Okay. So these people, I mean, many have health, some are doctors, some are scientists. Okay. Some are even economists. However, their job is to translate the language of the researcher into the kind of language that a policymaker will understand. Okay, avoid all the technical terms. So that's one way. Scientific language turned into language that a policymaker can understand. The other way is also important, is to talk to the policymakers and ask them what kind of questions are important to you that the researchers can address. So then their job is that after talking to the policymaker, is to go back to the researcher and say, hey, if you want your research to be important for policy, these are the topics that are of interest to the policymaker, not just the topics that are of interest to you, because sometimes the researcher are interested in topics which is of no interest to a minister of health, for example. So that's the quick answer to your question. You need to have units within the ministry to link the two communities, the researcher and the policymaker, so that each will understand the needs of the other. The second part of your question is even more important. Okay, why is it important? Okay, for people in the medical community, for doctors, for example, to understand that it is important for research uh, to influence policy. Okay, now let me begin with the individual level. Okay, let's say all of you graduate as doctors. You're looking after patients. Okay, so at the individual level, your responsibility is patient care. Many of you will be working in a hospital environment. All right. When you do that, hospital policies, for example, become very important. Okay. For example, hospital policy around infection control. Okay, how do you make sure in your day-to-day patient care work that you follow certain procedures like hand washing, using gloves, wearing masks, etc., to make sure that you actually don't spread antimicrobial, antibiotic resistant bacteria amongst your patient? Okay, so that's one hospital policy that you need to be aware of. Secondly, and going back to COVID, you need to also understand what are the hospital policies for protecting doctors, nurses, laboratory workers from getting infected, okay? Especially during a pandemic. PPE, for example, the use of personal protective equipment. Those are all governed by hospital policies. And of course, there's a whole range of other hospital policies on patient confidentiality, hospital policies around ethical behavior, etc., etc. So even as individual doctors and looking after patient, you need to be aware of what the policies are within your immediate working environment. Okay, so that's at the individual level. At the higher level, many of you after working in a hospital, maybe after becoming specialist, some of you will end up, for example, working in the Ministry of Health. Okay? And I'll give you a few examples of that later. And when you are working in the Ministry of Health, your responsibility will be not at the level of the individual patient, but it's the population as a whole. Okay? All the people out there, the communities out there. So from the health and well-being of the individual patient, you are not talking about the well-being and the safety of the entire population. Okay, let's say of DKI Jakarta, for example. All right. And this is where policy at the higher government level becomes very important. Okay. For example, the Indonesian government policy around universal healthcare, BPJS JKN, okay, that is trying to take care of the health needs of the whole country. All right, government policy during COVID, for example, government policy around access to COVID vaccines. You at that level need to be very aware of how those policies can affect the people as a whole. Okay, so to, to cut a long story short, I think the understanding amongst medical professionals, and I'm just not talking about doctors, but I'm talking about nurses, I'm talking about midwives, about community health workers. It is to understand that you have you have actually, if the word is not too strong, you really need to have an understanding of why policy is important, not at the level of the individual patient, but for the people as a whole. I hope I made sense.
Definitely makes a lot of sense and really insightful as well. Perhaps one thing that I'm quite curious is that your work in dengue previously, nevertheless, took notice of WHO despite it being decades ago. I imagine it's still scarce to see knowledge brokers and the such. Any tips on how more researchers can be heard that way?
Yeah, so let me go back to how I got into global health. Okay, when I was a researcher, there were three priorities for me. Okay, and anyone in academia will tell you the same thing. I want to publish papers. That's the bread and butter of a researcher. Okay, if possible, if my research is of a certain nature, I can get a patent for a particular invention. So that's the second P. And the third P is, oh, I want to become a professor. Okay? So papers, patents, professor. All right? And when I joined WHO, I realized that is a very narrow view of health. So when I became involved in global health, these three P's changed. Instead of papers, patents, and professor, it became people, practice, policy. All right. So the three P's change from being very narrow to achieve my ambition to become a professor into something which is much more pragmatic and actually impact people's lives. And really, that's what WHO is all about. WHO doesn't do research. It is focused on translating research into improving people's health. Okay, so I think in terms of advice about how people, medical students, health professionals can become interested in this particular trajectory. That is obviously one way. My trajectory is from academia, scientific research to international organization. Okay, on that trajectory, and generally speaking, my advice is don't get into, let's say, policy work too soon. Okay. You need to really establish yourself first. Whatever area of initial activity you want to focus on. In my case, it was research. In the case of many of you, it could be clinical work. Okay, so whatever it is, to get into policy too soon, it's not a good idea. You really need to sort of um, let's say do the legwork first. Do the hard work first. Establish your credibility. Establish your credentials as someone who can do and achieve something important in health. Then start thinking about, for example, joining WHO. Okay, what I want to emphasize is that joining an international organization like the WHO or like UNICEF or like FAO or like Unit Aid or UNFPA, all these big international organizations that work in global health, that is one trajectory, okay, that I follow. However, don't forget that with the kind of training and exposure and experience that you all have, that is not the only trajectory. Okay, I want all of you to think, every time I talk to students about this, everybody wants to join WHO. Okay, yes, it's nice. There is a sort of, if you like, a noble goal of the organization, but there are other ways in which you can contribute. And then let me just explain to you what these are. Firstly, people with your kind of background and training are very much in demand in the pharmaceutical industry. Okay? Global health will not be what it is today without the contribution of the pharmaceutical industry. Okay, so those of you train as doctors, you can join pharmaceutical industry. You can do clinical trials for new vaccines, for new diagnostics, for new drugs, etc., etc. You can be involved in the approval of those kinds of medicines. Okay, you can even do communication and marketing work. Okay, so don't forget the pharmaceutical industry. Secondly, and most importantly, government service. Okay, we need people with the right kind of training to join the ministries of health in all countries to help shape government policy on health. All right, and I'll give you some very good examples. In Singapore, for example, the Director General of Health is Dr. Kenneth Mak. He's a clinician. He still sees patients, but he is shaping government policy at the highest level. So that's the second one. Don't forget contributing to government. Thirdly, NGOs, civil society. There are many NGOs working in many important areas of tropical diseases as well as NCDs. Okay, there are international NGOs like World Vision. Okay, doing some very important work in countries around the world, especially in Africa, for example, around malaria, TB, etc., etc. Okay, so that's the third one. The fourth one, interestingly, okay, um, I'm pretty sure some of you have brothers, sisters, relatives that are working for big consulting companies. I'm talking about McKinsey. I'm talking about PwC. I'm talking about Deloitte. You know, all these big consulting companies. And you may think, what's the role of doctors? However, it has become more important. Okay, like when WHO wanted to reform its organizational structure, this is about 20 years ago when I first joined. Guess who they asked to do the restructuring? It was McKinsey. Okay, and I still remember the person who came to see me was an Indonesian guy who just graduated from medical school in the United States. Okay, so because of his background, he was helping McKinsey reform the WHO. Another very personal example. My youngest son, his name is Budi. Okay, so Budi, he's 29 years old. He went to university in the UK. He did economics, okay, as a subject. He did a master's in environmental economics, and then he got a job at PwC, PricewaterhouseCoopers. And I was wondering, Budi, you are not an accountant. What are you doing in a company which is doing mainly audit work? Then he informed me, no, Papa, PwC is now the implementing agent for the many programs that is under the control of the Global Fund to combat HIV, AIDS, TB, and malaria. So they created something called an International Development Unit. Okay, so in his team, there are two medical doctors working alongside him to manage those projects on HIV, TB, and malaria, mostly in African countries. So that's the fourth opening, you know, in terms of consultancies. And the fifth, the last one that I mentioned, is many philanthropy organizations, the Gates Foundation. Okay, in Indonesia, you have the Tahir Foundation, you have the Tahia Foundation, okay, you have the Tanoto Foundation. These are all philanthropies and charities working in the area of health. Okay, so don't just think of WHO. Okay, there are many other possible trajectories that people with your kind of training can follow. Okay, sure, WHO is one of them, but you can contribute in so many other ways. So sorry, that was a long answer to your question.
No, definitely it has been really, really mind-opening. I cannot believe like I thought you would stop at three, but you'll continue until five. That's a lot of possible paths indeed. I see. Perhaps in considering those paths, we also need to look into the future global health challenges that will be relevant. And I think they may be markedly different from what we know today. But it seems that inequalities seem to be their common line. People in the equator disproportionately, for example, will be affected by global warming. And there's also the issue of artificial intelligence accessibility and so forth. Do you think so? Or what challenges do you think will be the most formidable in global health in the years to come?
Indeed, absolutely. I agree with you. And the COVID-19 pandemic has really highlighted how disproportionately people in the poorer countries are affected. Okay, the inequity gap is widening. Okay, for example, the best example is access to COVID vaccines. People in poor countries couldn't even get a single dose when people in the rich countries already had 2 or 3 boosters. Secondly, it has widened the gap um, in terms of systemic racism, for example, gender inequality, poverty. Okay, the number of people who have lost their jobs, many more in the developing countries to the rich countries. So absolutely, I think, as you say, uh, things have changed now, and partly due to the pandemic, but those inequalities were there to begin with. The pandemic just made it worse. And just to comment on what you wrote in your question, it is not just countries in the equator, okay, or let's say the developing countries. These inequities, this widening is also happening even within the rich countries, okay? Within the United States, for example, the Black communities, the Latino communities, they are affected a lot more than the white communities. What about people who are in prison, people who are drug addicts? Okay, all these, let's say, disadvantaged groups, women, okay, people in the poorer economic income group, they are all affected, even in those rich countries. So, it's a global issue. So, yeah, that's the answer that, yeah, I certainly agree with you. Okay,
Wow, really
second part of
impressive.
your question is what I think are the most formidable challenges in global health, given what we've just said. I can give you a list which is very long, but I'm just going to highlight what I think are the three most important ones. The first is climate change. Okay, and I think the important thing here is to highlight that the three I'm going to mention goes beyond health. Okay, if anything, the world today has made us realize that health is not just confined to the health, to the medical community. It is multi-sectoral. It is influenced by things which are happening elsewhere. So the first obvious one is climate change. Give you some example. If you have global warming, increase in temperatures, what happens is mosquitoes breed faster, mosquitoes start to move to parts of the world where they were not seen before. For example, the southern part of the United States, the northern parts of Australia. Okay, and when these mosquitoes spread, you can imagine diseases will spread with them. Okay, for example, dengue, and importantly, even in Indonesia, malaria. Malaria, and this was a bit surprising to me, still in Indonesia, you still see hundreds of thousands of cases of malaria every year, about 3,000 deaths every year from malaria. Okay, so that's one impact of climate change, mosquito spreading disease. The other impact of climate change is when people destroy forests, deforestation. Okay, so if you destroy forests, what happens is some pathogens, some microorganisms that have never been in contact with human beings before, they can come into contact with human beings because the forests have been removed, they come into contact with humans, and that is a threat for the next pandemic, okay? Because people don't have immunity, all right? Another example for climate change. What we have seen in the last 20 years is what is known as extreme weather events. Okay? I'm talking about flooding. I'm talking about bushfires. I'm talking about droughts. I'm talking about hurricanes and cyclones. Okay? Extreme heat, for example. In France, about 4 or 5 years ago, during the summer, okay, old people were dying. And because they were living alone in apartments in Paris, their bodies were not discovered until 2 or 3 months later. Okay, because extreme heat, they were living alone, they died without people even knowing. In Pakistan, 2 years ago, they had massive flooding. The year after, they had a fivefold increase in the number of malaria cases. Okay, a more direct example, if you have flooding, if you have fires, you're going to destroy some of the community health centers. So that's a direct impact on healthcare delivery. Okay, I give you many more examples, but that's the first most formidable challenge I see, climate change. The second one is the increase in conflicts and geopolitical tensions. I don't need to tell you about this, what's happening in Israel, in Gaza, what's happening in Iran, what's happening in Ukraine, what's happening in many other parts of the world. And when things like this happen, okay, for example, you're going to start having refugees, okay? You're going to have migrants moving away from these countries which are affected by conflict, by civil war, by any kind of instability. In Asia, for example, is the Rohingyas from Myanmar, even trying to come to Indonesia, to Aceh. I remember a few weeks ago, there were some items they were trying to land in Aceh. So this conflict and geopolitical tensions, okay, is another big challenge. And it has a direct impact on health because if you have these people moving around the world, the potential of them carrying diseases is great. And the Rohingyas, for example, there is a refugee camp in Bangladesh with about 3 million of these Rohingyas. And they regularly have outbreaks of cholera, for example, because of pure sanitary conditions. Okay? So, unfortunately, that challenge is not related to health, but it has a direct impact on health. Okay, so increase in conflict and geopolitical tensions, and I'm gonna bet you that that's not gonna get better anytime soon. You think about what might happen. You look at what's happening now between China, Taiwan, and the United States. Okay, what's happening in the South China Sea between the Philippines and China? What's happening in North Korea, for example? Okay, all these geopolitical tensions are still there. Okay, of course, I'm hoping nothing will serious will happen. Okay, but if it does, there will definitely be an impact and a challenge for global health more importantly. The third challenge, and as I said, I'm gonna basically stick to three. This one is probably more directly related, but in a way not. Aging societies. Okay, basically, okay, you probably know very well. Japan, Korea, even China. By the year 2050, about 30% of their population will be above the age of 65. Okay, so when you have that, the burden on the healthcare system is going to be huge. 30% of the population, imagine, older people that usually have multi-morbidities, okay? I'm in that category, okay? All right. So older people, they probably have problems with limited mobility. They may have diabetes, but sometimes they also have heart disease. Some of them may even have cancer. So they need to be looked after by the healthcare system, okay, at a huge cost to basically the financing of healthcare. All right. So aging societies are going to be, I think, the other big challenge for all countries. Indonesia is not quite there. Okay. I think at the moment, the percentage of the population above the age of 65 in Indonesia is still under 20%. Indonesia is still a fairly young, demographically, is still fairly young. Like both you, the two of you. Okay. You're in the millennial. Is it, what's the group? Is it millennial or Gen Z? Millennials, right? You
Yeah,
guys?
I believe we are Gen Z indeed.
Oh, you are Gen Z. Okay. So we are not yet there, but I can bet you by 2050, that percentage will be higher for Indonesia. So, like the BPJS, they will have to start looking after more older people. Okay. So, those are the three most formidable challenges I see in global health. I can give you more, but let me just stick to those three.
Wow, wow, really insightful and totally agree that those are indeed really difficult problems indeed. With that being
Right.
said, what solutions and regulations from your experience are worth exploring to handle these problems and the conflicting interests as well, especially when those inequalities have systemic problems within and between countries?
Okay, once again, and I learned this from one of my professors. If you want to comment on something, just make 3 points, no more than three, because beyond three, people forget. Okay. So I'm gonna, in terms of solutions and regulations to deal with those challenges, I'm gonna mention three. The first one, which is probably more directly related to what we saw during the pandemic, is the role of international agreements and standards and norms around pandemic preparedness in countries. Okay, so the WHO has something called the International Health Regulations, and all countries in the world have agreed to those regulations. They are bound to implement those regulations to detect, to report, and to respond to any pandemic threat. Okay, so that is the first example. It's probably not a solution, but it is a regulation that, in principle, is there as a guide for all countries to follow in case there is a pandemic. Okay, now a second example of a regulation, which some of you may be aware of, is something called the Framework Convention for Tobacco Control. It's particularly important for Indonesia because, like the International Health Regulation, this is a set of actually legally binding rules, if you like, recommendations that all countries have agreed to follow to try and reduce smoking. Interestingly, unlike the international health regulations, Indonesia has not signed the Framework Convention for Tobacco Control. Let's not get into that. I can, if you have time, I can tell you the reasons why that is. So that's the first answer in terms of solutions. These two regulations, if followed, if implemented by countries, is at least guiding principles, norms, and standards for everyone to follow. Whether everybody does it, that's another story. Okay. Secondly, and going back to inequality, is there has to be more ownership and voices from the developing countries in terms of global health priorities. Okay. And the way in which this can happen is not going to be easy because, as I said, it's the rich countries that have the money. It's the rich countries that control most of the international organizations, like WHO, like all the UN organizations. Who are the countries which are supporting these international organizations? It's not Indonesia, okay? It's not Philippines. It's all the rich countries, okay? So how do you reform? Okay, the terminology that people talk about is global health governance. Okay, there's an architecture involving all the rich countries, all the rich agencies, even the scientific journals that publish a lot of research. All of these are English language dominated. They're in the US, in the UK, maybe some in Australia. Okay, so we need, as a second solution, to reform that. And what I have been hearing is the reform should be the governance should be more at the regional level, not at a global level. For example, in Southeast Asia, there's a lot of talk about ASEAN taking on a regional health role, okay, instead of WHO and the World Bank and maybe even the Asian Development Bank in Manila. Maybe ASEAN can play that role. So the solution is regionalization of how global health is controlled in the future. Okay, whether that's going to happen, that's a different question. Because, for example, ASEAN has very little money. With the budget that it has at the moment, there is no way it can take on the role of the WHO at the level of ASEAN, Southeast Asia. Okay? But the concept is, and there is a terminology around this, it's called decolonization of global health to make it more regional, to give countries in the equator, developed countries, more voice and more say. All right? So that's solution and regulation. The third one, the final one, is probably more aspirational. The solution is we need more goodwill amongst all countries, okay? More empathy on the part of the rich countries for the needs of the developing world, more solidarity amongst all countries, okay, especially amongst the developing countries. And finally, a commitment for collective action, okay, to work together, collaboration, cooperation, okay. Without those three, goodwill, solidarity, and I think maybe the key word here is trust. Okay, basically, for all those things to work, you need trust to happen in the future. And unfortunately, in the current world, that is in a bit of short supply. But when it comes to health, I hope that the COVID pandemic has really underscored the importance of trust in terms of how we move forward in the future.
Wow, really interesting and insightful indeed. You mentioned about decolonization, and I think that is a really interesting concept indeed. Out of our 29 countries that are currently members of AMSA International, interestingly, 18 are lower and middle income countries, meaning they have a GDP under 13,000 US dollars. As
Very
this,
good.
Mhm. So I guess as this podcast also serves as an encouragement for medical students, AMSA members who may want to be like you in global health, is there a message you'd like to convey to them?
Wow. I mean, against all that I have said, okay, uh, I would have to say now more than ever is when your voices are needed, especially those of you, those 18 countries which are in the lower income group of countries. Those are, it's your country needs you, basically. Okay. And that's where I would urge you to look at possibilities within your own countries through which you can make your country's voice be heard more loudly in the international arena. Okay. And I'm going to say directly to those members of yours from those 18 low income countries, don't think about WHO, at least not now. Okay. For now, your role is to work within your countries to try and say, hey, we need a stronger voice in global health. for the benefit of our country and for the benefit of other developing countries as well. Yes, maybe if you're successful 20 years after you graduate, okay, then you can join WHO, where you can even have more influence. Okay, I joined WHO at the age of 48, only after what I have sensed I have contributed to my own country. Okay, so that's my main message to all of you. Do your bit to increase the voice of low income, low middle income, even middle income countries. I think Indonesia is now probably in the upper middle income category, but things like that change. You know, you never know what happens. Well, I'm hoping that as far as Indonesia is concerned, that we have a new president coming in October. We hope that the priorities that has been put in place uh, by President Jokowi, which, as we know, is health, education, and poverty. We hope that will stay. We hope there will be no major changes in terms of implementation of BPJS, because in the long term, I firmly believe that universal health care and primary care, prevention rather than cure, is the way to go. Okay, so in terms of those of you thinking of careers in public health, okay, um, I'm going to tell you quite frankly, I hope not too many of you want to become brain surgeons or cosmetic surgeons. Okay, I hope not too many of you will want to become specialists earning high salaries. Okay, I hope more of you will end up in public health, in primary care, in immunization, in nutrition, all these areas that are more important than all these sort of highly specialized clinical specialties that many people sometimes aspire to. I just came from a meeting 3 days ago in Singapore where Dr. Suit, who's from Thailand, he was asked exactly the same question about specialists versus public health and primary care. And you know what he said? He said, specialists are actually bad for the healthcare system, okay? Because they suck up resources, they suck up equipment, and importantly, they do nothing for the poor, okay? Poor people don't need liposuction or cosmetic surgery to enhance their eyelids. Okay, they need primary care, they need vaccines, they need advice on healthy lifestyles, they need nutrition, they need advice on breastfeeding. That's the sort of stuff. Okay, so I better not get carried away on that topic, but that's my message. Primary care, public health. These are the areas I would hope that many of you will enter after you complete your medical studies.
Wow. Thank you very much, Prof. Tikki, for the message, for making the time, for sharing us insights today. Your passion truly reverberates through us younger generations. So it's truly a pleasure, and I'm sure our audience listening will have learned a lot. Ladies and gentlemen, that is Prof. Tikki Pangestu, global health expert and researcher.
Okay, can I just end with one word? Okay,
Definitely.
yeah, this is a personal anecdote. Okay, as I told you before, at my stage of my career, the greatest joy that I have is seeing my students do well. I was at a meeting 4 years ago in Kuala Lumpur, Malaysia, opening of the Asian Dengue Summit. There were four VIPs on the podium which opened the meeting. When they came down, they passed me the first guy, who is the Deputy Minister of Health. He said, "Oh, Prof, you were my teacher in medical school." That was Dr. Lee Boon Chai, Deputy Minister of Health. The second guy is Dr. Lucy Lam, who is a world expert on management of dengue cases in children. Prof, you taught me immunology in medical school. Good to see you. The third person was the Deputy Director General of Public Health, Dato Dr. Chong Chi Kiong. He was also my student. The fourth one, Dr. Azman, was Director of Health in Selangor State in Malaysia. All four of them were my students. That is the biggest kick I get at this stage of my life. And talking to you students, I hope in some ways I can help some of you to follow the path of these four. Okay? Sorry to extend the interview.
No, definitely truly a pleasure and to hear that anecdote. May all of us follow great paths for the betterment of health indeed.
Okay, all right.
Thank you so much again, Professor Tiki.